Yeah, hi folks, Dr. Larry Fee here. Today I'm going to put on my professor cap and talk a little bit about your relationship with your doctor or doctors. Over time, that relationship changes if you haven't noticed. And the main problem, as I see it, is that their expectations for you as you age become lower and lower or less and less. So if your expectations are not the same or similar to your doctor's expectations for you, then it's time to rethink things. What happens, you may have noticed, when you go to the doctor, you have a problem, very often they say, well, let's just watch it. And the unwritten statement is that, well, you're old, you're getting old now. I know from experience, I'm 83 now, and it's unstated, but their philosophy, and certainly the insurance company's philosophy, is that you'll be dead before this problem gets to you. I've personally experienced these sort of situations. For instance, about a year ago, I had a problem, coughing, whatever, and they checked my thyroid, and they imaged it with an MRI, and it showed that I had a mass growing on my thyroid that was took up about 20-25% of the thyroid volume. So I went to a specialist, directed to a specialist, and she said, well, let's give it a year. And I said, I don't want to wait a year. If it's cancerous, then we've given the cancer a year head start. So reluctantly, she signed me up for a biopsy. And even when I went to get the biopsy, the people conducting it, the physician and the nurse, they kind of scoffed at me for wanting to get this done. But fortunately, it came back that it was benign, the growth was benign, but I had peace of mind that I wouldn't have had otherwise. So as I referenced earlier, we start out, if you're older like me, I'm 83, you start out with a GP or general practitioner, and then now that title is called the PCP, or primary care physician. And as you get older, you probably may have experienced, you get sent to a specialist for this, for your back, or for irregular heartbeat, or something like that. So you're sent to somebody whom you had no choice in the matter, and you have no idea how they operate or how they're going to address you until you meet with them. And very often, they aren't that thorough because of your age. Also, as I entitled this video, Fire Your Doctor, well, it could be any of your doctors. If a couple reasons would be, if they're short with you, if they seem like they're in a hurry, if they seem to be on a time schedule and they don't have time for you, or if the doctor is discourteous, he doesn't treat you with dignity, he's not cordial, or he or she doesn't explain the symptoms, the problems, and the remedies that he advises. If he doesn't go into depth in that, then it's another example of what you should do. Fire that doctor and find yourself a better one, a better fit for you, one that respects you, your aging, and your well-being. Okay? Take care.